is Ailish Daly. Ailish is an allied health Beacon Hospital Research Institute. Ailish is an allied therapy manager in Beacon Hospital with a professional background in physiotherapy. She was responsible for the delivery of therapy services in the hospital. Ailish has led various patient-centred innovations, including early rehabilitation for patients recovering from cancer treatment, to help patients achieve their exercise targets. She's also supervised Horizon 2020 funded research studies investigating the role of sensor-based technology in patients' recovery following orthopaedic and oncology surgery. So I'd like to welcome both Ruth Whelan and Ailish Daly.
Thank you, Conor. So my name is Ailish Daly. I'm going to start the presentation and Ruth will join in a little while. So to start off, we'd just like to say thank you to Sandyford Business District, Conor and Sarah, for inviting us down today and to present. So we might start by saying, I think anybody that's listening to a talk on health innovation will expect to hear things like immunotherapy, next-gen sequencing, point-of-care testing, biosensors and trackers, and artificial intelligence. And we're going to touch on all of those things through our talk. But I think what we'd like to give is maybe the clinician and the person on the ground's perspective on health innovation and the work that we're doing in the hospital to try and build that culture and continue to continue innovation in the organisation. We'll talk a little bit about the hospital, give you a little insight as to the services we provide, talk about innovation in healthcare and our perception, how we're trying to bring that as a culture into our organisation through our 3 innovation pillars, and then talk about how we see that we're going to foster and secure innovation in the hospital going forward. So Beacon Hospital, it's up in Blackthorn Drive. It opened in 2006 as a one-ward quiet hospital. I joined in 2008, Ruth joined in 2006. So we've seen it grow from a one-ward hospital to now 180 inpatient beds. We've got 172 med-surg general purpose beds with 8 intensive care beds, which are quite topical at the moment. We've 1,300 staff from over 40 different countries, 281 consultants, 8 theatres, 4 endoscopy suites, a urology department, our specialist oncology day unit, 2 cardiac cath labs with cardiothoracic surgery as well, and an emergency department that's open from 10 to 7, Monday to Friday. So for us to be successful, we recognise that we need to continue to innovate with innovation that's based on quality. So the emblems you see at the top of the screen are some of the quality audits that we have to go through as a hospital on a regular basis. So the first gold one is Joint Commission International. So this is an external audit team who come from the States every 3 years, and they literally go through the hospital, literally from the roof to the basement. We've been on the roof with the auditors, we've been in the basement with the auditors, and they're looking through all of our hospital processes to make sure that we're reaching quality standards. And one of the things they look for is how we're using innovation to continue to grow and develop the hospital, continuing to offer high quality services to our patients. INAB is the Irish accreditation body for laboratory services in hospitals, and JAG is the accreditation body for endoscopy suites. So innovation in healthcare, why do we innovate and how do we innovate? So the first thing to recognise is that a hospital is a complex service provider. It sounds so obvious a thing to say, but when we think about innovation in the hospital, we have so many things we need to consider. First and foremost is the patient and their family. They're going to be the centre of everything we provide. So when we're thinking about an innovation project, we have to think, is this going to make things better? Is this going to offer better service to our patients and their families? And then we need to consider our stakeholders. So obviously our staff, but to think about that for a second, that's staff who are possibly clinicians like ourselves as physiotherapists, nurses, doctors, but it could be the finance team, it could be the patient services administration team, it could be the cleaners, it could be the dietetics team. So there's a huge complexity in the number of staff that we need to involve in our innovation projects. Then we think about customers outside of patients. So for example, the GPs that we serve, industry partners that may help to support innovation, our funders, obviously our health insurers, the Beacon Academy and our link with UCD and the other academic organisations in the country, they all have to be included and considered when we're thinking about innovation. And then it's obviously innovation is a key priority for healthcare. We all want to drive better quality of healthcare, better health, better quality of care. We want better patient outcomes. We all know that healthcare institutions in Ireland and across the world are looking at a rise in demand. The average age is going up, the needs of the elderly population is going to change, and we all have to deliver timely access to care, but constantly recognising that there is obviously financial implications on those things. So the drive to innovate and be more efficient and effective in how we deliver care is constantly there. We need to make sure we're compliant with regulation. Obviously, a big one with digital innovation is data protection, so making sure we're compliant from that perspective. But as I alluded to previously, we have the standards, the accreditation bodies that we need to make sure we're compliant with. So access to data analytics and trend analysis is really, really important for us. And then management structures. So every CEO in the country, be they for healthcare or for any other institute, any other organisation, is going to look at minimise waste, duplication, but also wanting to drive and make sure that we're continuing to offer the best service we can. So the innovation process at Beacon Hospital, when you work in a system with so many different disciplines and so many different people who are driven to continue to deliver really good care, there would be a huge amount of idea generation. So we have tons and tons of ideas. We're creating a system that create a flow of ideas. What becomes a little bit more challenging is selecting those ideas. So how do the ideas align with the strategic plan for the organisation? How do they align with the evolving needs of our patients? So we need to start filtering those ideas, but also making sure that the ideas we filter have life, and that the ideas that maybe we decide to put on hold, that there's a rationale for that, and that we're giving good feedback to the people who are coming up with those ideas, because we need to continue that idea generation. Then we help those ideas convert, so converting into products, services and practices, so be that an evolving practice in the physiotherapy department, or it could be introducing a complex surgery and bringing that conversion through to the entire team who's going to be looking after that patient. And then diffusing. So we'll talk about this in a little while when I talk about medical records. So making sure that if we have an innovation that we can, if we need to, that we can diffuse it across the organisation. So we can't have an innovation that only works for one cohort of our staff. It needs to be applicable and it needs to be reachable for everybody who's involved in that project. So then to improve our patient care, we base it on 3 pillars. So we've got IT and online platforms, diagnostics and medical products, and healthcare partnerships. And I'm going to talk a little bit about the IT and online platforms. Before we do that, could we have the video of the hospital? Thank Thank you. So our logo is This is Modern Medicine, and hopefully we'll talk a little bit about how we have the finger on the pulse of innovation. So first, looking at IT and online platforms, Dr. McDreamy doesn't work in our hospital, but this is to say that this presentation is from the position of a clinician rather than from the developer who's working on all of these projects. So in a previous life, I worked in a hospital in Oslo in Norway, where in 2002, their government mandated that all hospitals had to transfer to an electronic patient record. And then I returned to Ireland in 2006, and I still remember getting that massive big yellow chart for patient records, not the Beacon. And it was a bit of a shock coming back to a manual paper record. And then I came to Beacon, and we were starting a journey of moving to electronic patient records, but this would have been the day-to-day back in 2008. So we'd have had the shelves with the yellow chart, and then the purple folder, which is where we would have kept maybe the patient's drug prescriptions charts and certain other things. Folders go missing. When you've got written notes, you're looking at legibility issues, things like that. The yellow form is the surgery note, which is a crucial piece of documentation for any patient who comes through a hospital who's having surgery. And then the busy one, the phrases on the right, is our OBS chart. So that's how we keep track of the patient's heart rate, blood pressure, a lot of information on that form. So these would be like I suppose the structure of any medical record in any hospital that's reliant on a paper system. And we, as a hospital, decided we were prioritising a Go Digital project, and that project started back in 2008 really, but we progressed it further then in 2015. So we have our medical record, which is the greyish screenshots. That's where the nuts and bolts of the patient's record would be. That's where physiotherapy would input notes, nursing, lab, pharmacy, and then we've expanded it over the last few years to include a digital medical record as well, so that we can get more complex investigations saved there. It's got a much nicer layout, so it reads like a book rather than maybe a slightly old school screen, which would be the original. And then the next part of that project, which is really exciting, is we're looking at the op notes. So that crucial form, which is the surgical note that a surgeon fills out, usually in handwritten format at the end of a surgical case, and that gets filed physically in the chart. So we're moving that to electronic, which is going to be a huge transformation for the hospital. We'll no longer have any problems with legibility of op notes. We'll have full completion. We'll be able to pull data from it and audit it much better. But just to say it like that makes it sound like it's such a simple thing. I think clinical staff in the hospital have a joke that, oh, we'll just make it electronic. Whereas the amount of work that's required for this, you have to get the stakeholders, including consultants, nurses, all the people who use these documents to input as to how they're going to look, where they're going to sit. And then, of course, the developers will be able to tell me more about how we have to test it and trial it and make sure it doesn't crash, etc., etc. So it's a huge project that takes time. And I think that's probably what the IT guys have to teach us, the clinicians, over and over again, that these things are hugely complex to bring about. I just want to flick back to this slide, looking back to Grey's Anatomy again. We have the vision of going electronic, meaning we've iPads everywhere, we've all these high-vis screens, but it's to sometimes think that that might not be the best solution. So we looked at iPads and we found that the breakage was very high. Then we added covers, which meant that they were quite heavy, so staff weren't using them. So then we translated to a computer on wheels, or a mobile unit, which means that a lot of the functions that we use through our IT system, like requesting radiology, requesting consults, can all be done at the patient's bedside, but in a user-friendly, using a user-friendly device. Then we have a pocket-based device, which is the thing you see furthest on the right, which can be used for the nursing staff to input the patient's OBS. So that busy form that we looked at right at the start can now translate into this phone-based device to track heart rate, blood pressure, etc., etc. Much smaller, much easier for the staff to use, but it created its own challenges in terms of some staff actually found it slower, so we had to go back and revamp it and try and speed it up a little bit. So it's not to automatically assume that these electronic solutions will automatically make life better for everybody. And then because we're getting more and more electronic-based records, we're now able to mine the data in a more efficient way. So we can pull data from the record, bring it into one source of truth for staff, and then generate reports, views, and dashboards. But that in itself causes, I suppose, the IT department a few challenges, and now everybody wants these reports. So again, we have to go back to the hospital strategy in terms of what are the things we prioritise and how are we going to produce these. And one of the things we looked at was our patient safety metrics. So we'd pull data on patient safety, things like skin tears, med events, falls, data protection, notifications, and all of those now go into one data source, which can be mined into 5 separate event codes, 5 separate reports, which then can easily generate dashboard graphs, etc., presentations, which means that we have more on-the-spot reporting, and we can watch trending in a much more live manner. And then the final piece I'm going to talk to you about is data-driven innovation. This is one of the projects we're working with the Research Academy on. So it's a physiotherapist who's doing a PhD looking at using AI and big data to drive patient care. So his project is called Sky Scanner, and he's using, his theory is that by using AI to do searches for particular conditions to allow in real time, to allow the physiotherapist or whoever's treating the patient get suggestions, get ideas in a faster manner. And I'm going to hand over, before I hand over to Ruth, I just want to go through this the innovation strategic change. I think it's really, really important that if you're looking at digital innovation in a healthcare setting, you will have tons of people who can know want. In fact, you might have a lot more people that you may need to filter out the people in some ways to give yourself some targeted information. You will easily be able to create your story as to why you need to innovate, and you will need to sense how that innovation is going to be met across the organisation. Are there teams that are ready, there are teams that need support for it? But obviously, once it's prioritised, then there is a sense of urgency to it. You need to consider, will that innovation be able to be rolled out across the organisation, or is it to a particular team? Or if the goal is to roll it across the organisation, how will that impact across teams with different specialities, different backgrounds? Crucially important is the financial allocation. So if it's an internal project, there'll obviously be budget meetings, that'll be considered. But if you're looking at driving an innovation, a healthcare product, a technology-based healthcare product, that you need to consider who will be your funder at the end of the project. So is this going to be something that a hospital will pay for? Will it be something the insurers pay for? Will it be something the client pays for? And that's something that we see lots and lots of products come through, but maybe the innovators wouldn't always have had those thought processes. So it's definitely something to consider. If we're going to bring in something innovative and change, we need to think about what are we going to stop doing? Need to make sure we have leadership commitment and review from leadership as to where we're at. Make sure it's customer driven. So if your customer is your patient, make sure it's something that's going to make life better for your patient, and keep it simple and quantifiable. And I'm going to hand over to Ruth. Thank you.